Welcome to SSR Pharma Media, your trusted source for pharma knowledge. Today's series HAP Exam Edge Series MCQs for Success, Human Anatomy and Physiology. Today we are going to discuss about blood. Prepare, practice, succeed. So let's we discuss about the blood composition. So components of blood, plasma and cellular elements. There are two types are there in components of blood. The percentage of blood volume, plasma 55%, cellular elements so 45%. So major constituent present in the plasma, water, plasma protein, electrolytes, nutrients, hormones and other wastes. And in cellular elements, RBC, WBC, platelets. So these three are called as cellular elements. So functions of plasma, transport, osmotic balances and clotting, immunity. Cellular elements functions, carrying oxygen from outside to inside of the body cells and removing carbon dioxide from body to outside and transporter. That means oxygen, carbon dioxide transporter. Defense and clotting. So defense means act against immunity and clotting of the blood. So this portion is called plasma. It's containing the water, plasma proteins, electrolytes, nutrients and hormone wastage. And this part red color is containing the cellular elements. And this white is the white blood cells, WBC. So we'll move on to the question. What percentage of total blood volume is plasma? So option A 25%, option B 45%, option C 55%, option D 70%. So the answer is option C. So 55% of blood plasma is present in the blood. Other 45% is elemental. So it's a cellular elemental like RBC, WBC and other platelets. So once again we will discuss the blood composition. So the water is a major part of the blood. So it's containing 90 to 25% of the composition of the blood. And its main role is it acts as a solvent and medium for transporters. And remaining plasma protein 6 to 8 gram per deciliter. So in this plasma there are various plasma proteins are present. So albumin, globulin, fibrinogen and other solutes. So albumin is 60% of proteins. It is present in the plasma. Its main function is maintains osmotic pressure and carrier proteins. And globulin 36% is present in plasma. So it is a type of alpha beta transporters and gamma is act as antibodies. So there are three types: alpha globulin, beta globulin and gamma globulin. So in this alpha beta act as a transporter, gamma is act as antibodies. And fibrinogen, it is involving in the clotting factors. So converted to fibrin is a clotting. So other solute, so more than 1%. So like electrolytes, sodium, potassium, calcium and other nutrients, hormones and waste materials of urine, urea and bilirubin. So it's in this plasma protein present in the blood abundance. So in the blood more amount of plasma proteins are present. So in that ratio albumin, globulin, fibrinogen. So albumin is a high amount than globulin. Fibrinogen is more amount than globulin is more amount than fibrinogens. So this is the order: albumin, globulin, fibrinogen. Albumin is more amount than globulin. Globulin is more amount than fibrinogen. Move on to the question. Which plasma protein is primarily responsible for maintaining colloid osmotic pressure? So option A, fibrinogen. Option B, albumin. Option C, globulin. Option D, prothrombin. So colloidal osmotic pressures, option B is the albumin. Albumin constitutes 60% of plasma protein and maintains plasma oncotic pressure, preventing fluid leakage into tissue. So maintaining is the osmotic pressure, preventing fluid leakage into tissue. So next, which plasma protein function as an antibody? Option A, albumin. Option B, globulin. Option C, fibrinogen. Option D, transferrin. So plasma protein functions as antibodies. Main function is option B, globulin. So globulin is a gamma type of plasma protein. Its name called globulin. So immunoglobulins, otherwise also called as immunoglobulin, act as the antibodies, playing a central role in immune defense. So next, which pigment imparts the yellow color to the plasma? Option A, urobilin. Option B, bilirubin. Option C, hemoglobin. Option D, keratin. So the answer is option B, bilirubin. So bilirubin is a breakdown product of hemoglobin during metabolism. Gives plasma its yellow color. Which of the following formed elements are unnucleated in humans? Option A, neutrophils. Option B, monocytes. Option C, red blood cells. Option D, lymphocytes. So the answer is option C, red blood cells. So formed element unnucleated. See, red blood cells is the answer. So matured RBC in human lose their nuclei to increase hemoglobin content and maximize the oxygen transporters. So which component is removed from plasma to obtain serum? Option A is a very important question. Option A, albumin. Option B, globulin. Option C, fibrinogen. Option D, electrolytes. So the answer is option C, fibrinogen. Fibrinogen is removed from plasma is called serum. Serum, it is a type of clotting factor, mainly fibrinogen. Thus, serum lacks fibrinogen, but it contains all other plasma proteins, electrolytes and other solutes. Except fibrinogen, remaining all is present same like a plasma. So if you see this tabular column, you'll see the count and lifespan of the blood cells. So RBC, it's also called as erythrocytes. It's contain 5 million per microliter and its lifespan 120 days, and its main shape of this is biconcave. It does not containing any nucleus, and the main function is oxygen and carbon dioxide transport via hemoglobin. So next, WBC, it is also called as leukocytes. So it is present 4,000 to 11,000 per microliter. Its lifespan is few hours and it's containing nucleated and immune cells. It's act as a immune cells. So main function is body defense. It's involving body defense mechanism. Neutrophils, 60 to 70% of WBC. So these are all types of WBC cells. 60 to 70% of WBC. So lifespan 6 to 8 hours. It's a multi-lobed nucleus. So it is a type of multi-lobed nucleus, and it's involving the first line defense mechanisms of phagocytosis. Lymphocytes, it is 20 to 25% present per microliter. So lifespan months to year, and it's a large nucleus. It's containing large nucleus and is mainly involving in the immunity type B, D, T and B cells. Monocytes, 3 to 8% presence in blood, WBC, and its lifespan some days, and it is a type of kidney-shaped nucleus. It's containing kidney-shaped nucleus, and it's mainly involving in the differentiates in the macrophages. Eosinophils, 2 to 4% present, and its lifespan 8 to 12 days. So it containing bilobed nucleus and red granules, and it's involving in the allergy, parasitic defense mechanism. And basophils, so more than 1%, and its lifespan few hours to days. It containing blue granules, histamine release, and its main function is inflammation and allergy. It's act against inflammation and allergy. And platelets, thrombocytes, it 1,50,000 to 4 lakhs, lifespan 8 to 12 days. It main features of this is small cells fragment, no nucleus. So it's mainly involving the clotting and clot retraction and wound repairs. So if you see this, the amount of the percentage present in the blood, first is the neutrophils more than lymphocytes, and lymphocytes are more than monocytes, monocytes are more than eosinophil, eosinophils are more than basophils. So this mnemonics, never let monkeys eat bananas. Neutrophil, lympho, N is a neutrophil, L is a lymphocytes, M is the monocytes, and E is the eosinophil, B is the basophil. So this is in this order, it is present in the WBC and in blood. So we'll move to the question. The average lifespan of RBC in human blood, 60 days, 90 days, 120 days, 150 days. So the answer is 120 days. So RBC survive 120 days, after which they are destroyed in spleen. Next, which type of WBC is the second most abundant in normal human blood? Option A, monocytes. Option B, lymphocytes. Option C, eosinophil. Option D, basophil. So the answer is option B, is a lymphocytes. So WBC order of abundance, lymphocytes 20 to 25%, or second most common after neutrophil. So among this answer, lymphocytes are more abundant present in the WBC than neutrophils. So neutrophil is not present in this answer. So we have to choose the lymphocytes. Next, which of the following is not a granulocyte? Option A, neutrophil. Option B, basophil. Option C, eosinophil. Option D, monocytes. So the answer is option D, monocytes. Monocytes are agranulocytes. They differentiate into macrophages. Next, which of the following formed elements are anucleated in humans? Option A, neutrophil. Option B, monocytes. Option C, red blood cell. Option D, lymphocytes. So the answer is option C, red blood cells. So matured RBC in human lose their nuclei to increase hemoglobin content and maximize oxygen transport. So which blood component is essential for clot retraction? Option A, platelets. Option B, fibrinogen. Option C, thrombin. Option D, calcium ion. So the answer is option A, platelets. Platelets contract using actin, myosin-like protein and causing clot retraction and wound closures. Next, which of the following is the most abundant type of leukocytes in human blood? Option A, neutrophil. Option B, lymphocytes. Option C, monocytes. Option D, eosinophil. So more abundant means is a option A, neutrophil. So option A, neutrophil, 60 to 70% of WBC, and are the first responder in bacterial infection. So you see the order, never let monkey eat bananas. So neutrophil, lymphocytes, monocytes, and eosinophil and basophil. This is the order. Next, which type of WBC is involved in allergic reactions and parasitic infections? Option A, basophils. Option B, neutrophils. Option C, eosinophils. Option D, lymphocytes. So the answer is option C, eosinophils. So eosinophil release major basic protein against parasites and increases during allergies. Next, which WBC transform into plasma cells to secrete antibodies? Option A, T lymphocytes. Option B, B lymphocytes. Option C, monocytes. Option D, neutrophils. So if you like this video, please like and subscribe. Answer is option B, B lymphocytes. B lymphocytes differentiate into plasma cells producing immunoglobulin. It acts as the antibodies. You see blood coagulation. Next we will see the blood coagulation. Overview of blood coagulation, blood clotting, hematosis. So this hematosis is a step bleeding after vascular injuries. It is a stop bleeding after vascular injury. Involves platelets, clotting factors, calcium and vitamin K. So final product. So we will discuss about blood coagulation, overview of blood coagulation, blood clotting, hematosis. It stops bleeding after vascular injuries. So involves platelet, clotting and calciums and vitamin K. Final product, fibrinogen clot that stabilize the platelet blood. So the blood coagulation, there are three factors: intrinsic factor, extrinsic factor, common factor. Intrinsic factor is containing its factor, it's involved factor 12, Hedgeman factor, and its a key factors 12, 9, 9, 11, 9, 8. And it is involved in the lab test activated partial prothrombin time, prothromboplastine time. And extrinsic factor, so tissue factor, factor 3 and factor 7. So factor 3 and factor 7 is involving prothrombin time. Common factor, factor 10 activation 10A. So involving 10, 5, 2 is a prothrombin, 1 is a fibrinogen and 8, 13, factor 13. So involving both prothrombin time and activated partial thromboplastin time. So clinical correlation, hemophilia A is equal to, it is a deficiency of factor 8. It's a very, very important. Hemophilia A is a deficiency of factor 8. And hemophilia B is a deficiency as a Christmas disease, is a deficiency of factor 9. So capital Roman letter 1 and X. It's a factor 9. We'll move next. Which of the following is the vitamin required for the synthesis of clotting factor 2, 7, 9 and 10? So option A vitamin C, option B vitamin K, option C vitamin A, option D vitamin E. So the option is option B is the answer. Vitamin K is the essential for gamma carboxylation of glutamic acid residue in clotting factor 2, 7, 9 and 10, which is necessary for calcium binding and activity. So which clotting factor is also known as anti-hemophilic factor A? Option A factor 8, option B factor 9, option C factor 11, option D factor 7. So the answer is option A factor 8. So hemophilia A is caused by deficiency of factor 8. It's a anti-hemophilic factor A. It is also called as anti-hemophilic factor A. Factor 9 deficiency causes hemophilia B. Next, the intrinsic pathway is initiated by the activation of which factor? Option A, factor 7. Option B, factor 9. Option C, factor 12. Option D, factor 5. So the answer is option C, factor 12. So factor 12 is a Hedgeman factor, is activated upon contact with negatively charged surfaces. So initiating the intrinsic pathway. Next, which factor is also called prothrombin? Factor 1, option A, option B, factor 2, option C, factor 5, option D, factor 10. So the answer is factor 2, option B. So factor 2 is the prothrombin, which is converted to thrombin by prothrombinase complex. Next, hemophilia B results from deficiency of which factor? Option A, factor 7, option B, factor 9, option C, factor 8, option D, factor 11. So the answer is option B, factor 9. So hemophilia B is a Christmas factor disease due to factor 9 deficiency. So next, so hemophilia B results from deficiency of which factor? Factor 7, factor 9, factor 8, factor 11. So the answer is option B, factor 9. Hemophilia is the Christmas factor due to deficiency of factor 9. The hormone stimulating RBC production is option A, prothrombopoietin, option B, thrombopoietin, option C, renin, option D, calcitonin. So the answer is option B, erythropoietin. So erythropoietin it is synthesized from kidney. It stimulates the erythropoiesis in bone marrow during hypoxia. So if you see this blood disorders, is a very important blood disorders. So type of blood disorders, iron deficiency first we will say. So iron deficiency means decreased RBC and decreased hemoglobin content. So iron deficiency anemia, it's also called as chronic blood loss, poor diet. And pernicious anemia caused due to vitamin B12 deficiency. And folate deficiency anemia due to poor diet, alcoholism and pregnancy. Ablastic anemia due to deficiency in bone marrow failure. And sickle cell anemia due to hemoglobin mutations, beta globin defect. And thalassemia is a genetic defect in globin chain synthesis. So if you see the WBC, when decreases will get anemia. When increases, it is called polycythemia. Polycythemia vera, it is a proliferative disorders, and secondary polycythemia is a high altitude COPD PEO secreting tumors. So due to this, it formed the polycythemia. Polycythemia means increased RBC. And when we will move to the abnormalities of WBC, leukocytes disorders. So these are leukocytosis, leukopenia, leukemia. There are 3 disorders are there. Leukocytosis means it's caused infection, inflammation and stress. So increasing WBC counts. And leukopenia is a bone marrow suppression, viral infections, decreased WBC count. And leukemia is a malignancy of bone marrow due to acute, chronic, myeloid and lymphoid. So the abnormal increased WBC, anemia, bleeding and infections. So normally when we will get any cold or any infection, the WBC counts get increased when we take the blood count. So WBC count will be high, shows in the high. So due to the infections like a cold, fever or some other viral infections or inflammations. Next, platelet disorders, thrombocytopenia, thrombocytosis and disseminated intravascular coagulations. So it's a drug, it's thrombocytopenia due to drugs, heparin, immunorestrictions and bone marrow failure, decreased W platelets. And thrombocytosis due to reactive, and it is increasing the platelet, thrombosis. And disseminated intravascular coagulations, excessive clotting, present bleeding, and it's due to microthrombi and presence bleeding. So next, which of the following is the hereditary disorders of hemoglobin synthesis? Option A, sickle cell anemia. Option B, thalassemia. Option C, hemophilia. Option D, leukemia. So the answer is option B, thalassemia. Thalassemia is caused by mutation leading to reduced synthesis of alpha beta globulin chains. So next, which of the following is myeloproliferative disorders characterized by excessive RBC? Option A, polycythemia. Option B, leukopenia. Option C, ablastic anemia. Option D, thrombocytopenia. So option A is the answer. So polycythemia vera. So polycythemia vera is due to bone marrow overproduction of RBC, increasing blood viscosity. Next, megaloblastic anemia can be caused by deficiency of vitamin C and vitamin E. Option B, iron and copper. Option C, folic acid and vitamin B12. Option D, zinc and magnesium. So the answer is option C, folic acid and vitamin B12. Both folate and vitamin B12 are essential for DNA synthesis. Deficiency leads to large immature RBC precursors, megaloblast in bone marrow. Next, in sickle cell anemia, the defect is due to option A, deficiency of folic acid, option B, mutation in beta globin gene, option C, excess iron deposition, option D, autoimmune hemolysis. So the answer is option B, mutation in beta globin genes. So sickle cell anemia is caused by point mutations in beta globin chain of hemoglobin. So it is glutamic acid via valine at the position 6. Changes happens. So leading to abnormal HBS and sickling of RBCs. Next, pernicious anemia is caused due to deficiency of which vitamin? Option A, vitamin C. Option B, vitamin B12. Option B, vitamin B6. Option C, vitamin B12. Option D, vitamin K. So the answer is option C, vitamin B12. Pernicious anemia results from impaired absorption of vitamin B12 due to lack of intrinsic factor produced by gastric parietal cells. It leads to megaloblastic anemia. So next, blood grouping: universal donor, universal recipient, universal RH incompatibility, and Bombay phenotype. So universal donor group O and universal recipient grouping AB. RH incompatibility causes hemolytic disease of newborn, and Bombay phenotype, number of H antigen, rare group, needs same group blood only. So universal donor for whole blood is group AB and B, group A and group O and group B. So the answer is option C, group O. So blood group O has no AB antigen on RBC. So it can be donated to any group through plasma antibodies. Limit its use in plasma transfusions. So next, the RH factor is clinically important in option A, sickle cell anemia, option B, pernicious anemia, option C, erythroblastosis fetalis, option D, thalassemia. So the answer is option C. So erythroblastosis fetalis. So in RH incompatibility, an RH mother carrying RH fetus produces anti-D antibodies that can cross the placenta in subsequent pregnancy, causing hemolytic disease of newborn babies. So next, Bombay blood group. So HH phenotype is characterized by absence of option A, RH antigen, option B, H antigen, option C, A and B antibodies, option D, D antigen. So the answer is option B, H antigen. So in Bombay blood grouping, the H antigen is absent. So hence A and B antigen cannot be expressed, and these individuals have anti-H antibodies, making transfusion and extremely difficult. So which blood grouping is known as universal recipient? Option A plus, option B, O plus, option C, AB plus, option D, AB minus. So tell in comment box, put your answer in comment box. Thank you. So if you like this, please like and subscribe. Join in our WhatsApp community. You will get hands-out material and test series. So thank you. Like, subscribe and share.